Hello, I'm Bretton, one of our MCAT tutors here at Inspira Advantage, where we help students get into medical school and other professional programs. And welcome to MCAT Bites. Today we're exploring the vital topic of ethics in medicine and research. This subject is at the heart of clinical practice and biomedical science, ensuring human decency, fairness, and respect in healthcare and scientific inquiry. It's also important for the MCAT, as they will ask you 2 to 3 questions on medical ethics that are mostly straightforward questions, but I want to make sure you have the vocab down to make these questions a breeze. Additionally, this can help you score better on the Casper exam if you kind of know what they're looking to hear. So let's begin with, what is medical ethics? Medical ethics is a system of moral principles that apply values and judgments to the practice of medicine. It encompasses a wide range of issues in healthcare and medical research, from patient confidentiality and informed consent to the ethical considerations of genetic testing. The cornerstone of medical ethics include 4 primary principles. We have the pillar of autonomy, beneficence, non-maleficence, and justice. These principles guide physicians in providing care that respects patient decisions, benefits the patient, does no harm, and distributes healthcare resources fairly. Let's dive a bit deeper into their definitions. For autonomy, this is really about respecting the right of patients to make their own healthcare decisions. This principle asserts that patients have the right to choose and refuse treatments based on their values and beliefs. It underlines the importance of informed consent, ensuring the patients are well informed about their treatment options, the potential benefits, and risks involved, thereby empowering them to make decisions that align with their own personal health goals and ethical values. An example of this could be if somebody is religion X and they refuse treatment because they aren't allowed a blood transfusion because of that religion. The doctor would have to explain to them the pros and cons of this, but ultimately the patient gets to decide. Next, we have beneficence. Beneficence demands that health providers act in the best interest of the patient. This involves providing treatments that are beneficial to the patient, actively contributing to their well-being, and taking proactive steps to prevent and remove harm. Physicians must balance the benefits of treatment against the risks and costs, striving to achieve the best outcome for the patient. An example of this could be if a patient has cancer and they aren't likely to live for very long regardless of the treatment. Sometimes it's in the patient's best interest to suggest not undergoing the most stringent therapy, even if it will extend life a few weeks because of the amount of pain it would put the patient in. But this intersects well with autonomy because ultimately it should be the patient's decision to choose treatment or to forego treatment. Third up, we've got non-maleficence. This is encapsulated by the maxim, do no harm. It obliges healthcare professionals to not intentionally create harm or injury to the patient, either through acts of commission or omission. So by adding something or by not doing something. It complements beneficence, emphasizing the need for medical practitioners to consider the possible harm that any intervention might cause, ensuring that the potential benefits outweigh these risks. And then finally, justice refers to the equitable distribution of healthcare resources and the fair treatment of all patients. This principle addresses issues of fairness and equality within healthcare, including access to services and allocation of resources and the burden of healthcare costs. It challenges the medical community to consider the wider social impact of healthcare decisions and policies, ensuring that treatment and resources are allocated based on medical need and not influenced by factors such as race, age, gender, socioeconomic status, or personal connections. Let's go into a practice case study here. Informed consent is a critical aspect of ethical medical practice, ensuring patients are fully aware of the benefits and risks and alternatives to any treatment or procedure. It exemplifies respect for the patient's autonomy and supports shared decision-making. For the MCAT, you're also supposed to know a little bit about research ethics, especially when that intersects with medicine. So these are typically medical studies. Ethics in research addresses the right and wrong in conducting scientific studies, particularly those involving human subjects. The primary goal is to protect participants from harm and respect their rights and dignity. It's also important to get informed consent, which we just talked about. And this is where you explain what is being done to the research subject in a way that they understand and agree to. So if you're working with a lay audience, this means not using big scientific words. It means simplifying it down so that they can understand what it is they're agreeing to. As medicine and technology advance, new ethical challenges emerge, such as the debate over gene editing and the use of artificial intelligence in healthcare. These advancements require ongoing ethical analyses and dialogue to navigate complex moral landscapes. Some practical ways people are attempting to mitigate these issues are by bringing locals into the conversation with scientists. For example, before a gene drive was put into mosquitoes, the scientists met with the local council of elders on the island And the researchers essentially gave them a presentation trying to get informed consent, explaining why it would be effective and safe. After hearing the presentations, the elders said no due to spiritual reasons, and then importantly, the scientists respected their wishes and didn't kill all the mosquitoes on their island. Even when it seems like a poor scientific decision, you still have to respect informed consent. Ethics in medicine and research ensures the advancements in healthcare and science are conducted with respect for human life, dignity, and rights. As future medical professionals, understanding and applying these ethical principles is crucial for your practice and well-being of your patients, as well as getting, those 3 to 4 questions on the Psych/Soc section. So thank you so much for watching our video on ethics in medicine and research, and I will see you next time.